Hi, my name is Megan LeBlanc, and I'm here to do a head-to-toe assessment on you. I'm going to be your nurse for today. Can you state your name for me, please?
Gerard, Alabama.
And where are we at right now?
The house,
And what time is it?
4 p.m.
And why are we here?
Head to toe assessment.
Okay, I'm going to go ahead and get started. I'm going to start by assessing your head and your hair. Your hair is evenly distributed, and it's a normal color and texture with no balding or severe dryness. And your scalp looks a normal color. It's not excessively dry. It's not flaking. And I'm going to feel for your skull. And palpate your skull to see if it feels symmetric with no lumps and there's no lesions present in your scalp or hair. And everything's symmetric. Now I'm going to assess your ears. And does this hurt when I touch it? Is it tender?
No.
No? Okay. Now I'm going to assess your hearing. Can you hear that?
Yes.
Okay. And this is a normal size and shape for his age. And it is not more than 10 degrees from a vertical line. It is aligned with his eyes, like it should be. This is also a normal size and shape. Does this hurt when I touch it?
No.
Okay. And can you hear this?
Yes.
Okay. And this is not more than 10 degrees from a vertical line also. And it is aligned with his eye, so that's normal. Go ahead and look at me. Now I'm going to assess your eyebrows, and they are full and bilaterally, and they're a normal color and texture. Close your eyes for me. Your eyelids are non-drooping. They are a normal color, and I'm going to check the turgor of them. And the turgor is normal. The eyelashes are evenly distributed and full, and they're a normal color. Open your eyes for me. Now I'm going to check your sclera. And your sclera is white. It has a few brown pigmentations in it, but that's normal for your race. And it's also white, except for those pigmentations on this side. And now I'm going to check your conjunctiva, which is pink and clear. Pink and clear bilaterally. And your sclera is also clear. And I'm gonna palpate your temporal pulses, and they are present bilaterally, and it's palpable. And now I'm going to assess your vision. Go ahead and follow my finger, but don't move your head. And did you lose sight of my finger at any point?
No.
Okay, so your vision is present in all 6 fields. And now I'm going to get my pen light. And I'm going to assess for accommodation to light. So just go ahead and look straight for me. And the other side. And your pupils did constrict equal bilaterally. So you do have accommodation to light. And now I'm going to ask you to focus on an object in the distance, and just focus in on that object, and don't move your eyes, and just try to see the details in that object, and maintain that for a few seconds for me. And now look at me. And your pupils did constrict slightly, so you do have accommodation present. Now I'm going to assess your face. Your temperature is warm and equal bilaterally. There are no lesions or acne present on your face. It's moist and clear. And your turgor is good. Now I'm going to assess your nose. It is slightly mobile. Go ahead and look up for me so I can see in your nose. There's no obstructions in your nose, so it's a clear pathway. And then I'm going to assess your lips, which are their normal color and they're free of chapping or flaking. And your facial hair is distributed evenly. It's a normal color and texture. Go ahead and open your mouth for me. And your teeth are in alignment, and there's no cavities visible. Your mouth is moist with no odor. And go ahead and stick your tongue out for me. And your tongue is pink and textured, which is good. Go ahead and close your mouth. And now go ahead. I'm going to check your face for symmetry. So go ahead and smile for me and frown. Okay. And now I'm going to palpate your carotid pulses right here. It is present and palpable bilaterally. And now I'm going to osculate your carotid artery. And there's no bruits present. Bilaterally. And I'm going to inspect your jugular vein for distension. So go ahead and look up for me and tilt your head to the side. I'm going to inspect for the jugular vein. The pulsations are slightly present, but the vein itself is not, and it's not distended. And tip up and over. And the same bilateral, pulsations present, but the vein is not, and it's not distended. So that's good. And now I'm going to assess your trachea. It is midline of your neck. It is slightly mobile, which is normal. And now I'm going to assess your lymph nodes. So I'm going to start down here. I'm going to go up towards your ear in a straight line. I'm going to go in front of your ear and behind your ear. I'm going, there's another line right here. And one more towards your hairline. There's some towards a couple towards your shoulder. I'm going to feel for. And one more towards your trachea. Then I'm going to go down your jawline. Towards your chin. And up your jawline. Towards your nose. And these lymph nodes were palpable and slightly mobile. Did it hurt? Was it hurt at all or tender when I palpated those? No. No? Okay. They didn't seem enlarged or swollen. I'm going to start down here and go up towards the ear. And go behind the ear, in front of the ear. And there's another line right here. One more towards the hairline. One more towards the trachea. And some down here by the shoulder, a couple. And now I'm going to go towards your chin. And then up towards your nose from your jaw. And those were the same as the other side, palpable and slightly mobile. Did it hurt at all when I touched this side? No. Okay. So they had no tenderness, and they didn't seem enlarged bilaterally. And now I'm going to inspect your arms, assess your arms. And your hair distribution is equal bilaterally. The temperature is warm and equal bilaterally. Muscle tone equal bilaterally. The turgor is present in both arms. There's no lesions present, and there's a normal color. And now I'm going to ask that you grip my hands and squeeze. And you do have a strong grip bilaterally, so that's good. And I'm going to assess your fingernails. And you do have, they are a normal size and shape and color. The nail beds are at about 160-degree angle. And I'm going to check your capillary refill, which is less than 2 seconds. On the other side. These are also a normal size, shape, and color. The angle is also about 160 degrees. And check the capillary refill. And it's less than 2 seconds bilaterally. And now I'm going to do your chest. Ask that you take a deep breath. Another one. And another one. The chest expansion did feel equal bilaterally. There was no lifts, heaves, or throws felt when I did that. So, and his breaths have been even and unlabored, sorry, throughout this assessment. I've been watching it. So go ahead and stand up for me and turn this way. Now I'm going to check his chest expansion. So go ahead and take a deep breath. And another one. And my thumbs did separate equally, which shows that he has equal chest expansion on both sides. Alright, so now I'm going to go ahead and have a seat. I'm going to feel your chest and abdomen, and it is a normal temperature, normal color, free of lesions. And is there any tenderness in your thorax when I palpate it? No? Okay. And the turgor is good. It's moist and smooth, and the muscle tone is even bilaterally. Now I'm going to auscultate your lung sounds. Two, three, 4, 5, 6, 7, and 8. Then I'm going to check your lateral side. So it would be 1. Go ahead and raise this arm up for me too. 1 and 2, 3 and 4, 5 and 6, and 7 would end over here because there is a third lobe on the right side of in the lungs. And then I'm going to do the back side, so go ahead and stand up for me. I'm going to start, just breathe normal for me. 1 and 2, 3 and 4, 5 and 6, 7 and 8, 9 and 10. And so all lung sounds were clear, and his breathing was even and unlabored. So go ahead and have a seat for me. Now I'm going to oscillate your heart sounds. I'm going to start here, the first intercostal space. Move over here, 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 and then the 5th one in the mitral space. And then I'm going to turn it over and oscillate it again. And 2, to flip it over, and I'm going to oscillate his apical pulse for 1 full minute and determine the rate, his apical heart rate. And I would be watching this for 1 full minute, counting the beats, and I would report that. This is apical heart rate. And I'm going to check your radial pulses. I'm doing them both at the same time. They are both equal, and then they're easily palpable bilaterally. And then I'm going to do the radial pulse. Okay. They are both present and slightly palpable. And now I'm going to finish assessing your abdomen, so go ahead and stand up for me. And I'm going to assess your anterior to posterior to lateral ratio is 1 to 2, which is normal. And your ribs slope at about a 45-degree angle. Your costal angle is less than 90 degrees. So that's normal. And then I'm going to oscillate your bowel sounds. I'm going to start in this quadrant and do this quadrant, and this quadrant. And then I flip it over and use the bell to oscillate your vascular sounds in all 4 quadrants. Okay, now I'm going to assess it for symmetry. So I'm going to look at from a side view and look for any asymmetries, which there's not. It's symmetrical. Go ahead and squat down and look for me so I can see from over your shoulder. Go ahead and sit down for me. I would be behind him looking over for any asymmetries, which there is not. It's all equal. And now I'm going to palpate. Do you feel any tenderness or pain when I do this?
No.
Okay. And now I'm going to palpate for masses. Which there are no masses present. And do you feel any pain or tenderness while I did that? No. Okay. And now I'm going to assess your legs. And your hair is evenly distributed bilaterally. It's a normal color and texture, and amount, and the temperature is warm and equal bilaterally. Your skin is smooth and moist, free of lesions, and your muscle tone is equal bilaterally. Now I'm going to assess your turgor, which is present bilaterally. And then I'm going to assess your toes, which your toes are normal size, shape, and color. Capillary refill less than 2 seconds. Also normal size, shape, and color. Capillary refill less than 2 seconds bilaterally. And now I'm going to ask that you do the Homan's test by putting your leg up and flex your foot as far as you can. And do you feel any pain in your calf when you do that? No? Okay, so that's good. And now I'm going to check your peripheral sensation on this side. Do you feel this?
Yeah.
Yeah? Okay. Put your leg up. Flex your foot down. Do you feel any pain on this side? No? And can you feel this?
Yes.
Okay, so I did the Homan's test and checked for peripheral sensation, and it was present bilaterally. And while we were doing this, I have assessed his speech, which was clear, and he was able to comprehend what I was saying during the conversation. He had a normal tone and consistency of voice, so that is good. And now I'm going to ask that you stand up so that I can assess your gait. So go ahead and just walk how you normally walk across this room and back. And you do have a steady and balanced gait, and it was upright, so that's normal. And go ahead and walk in a straight line for me, heel to toe. Okay. And you were able to maintain your balance during that test, and you do have a normal gait that's steady. Okay, so now we're going to do the Romberg test. And put both feet together, hands to your side, and look straight and close your eyes. And see if you're able to maintain that position. Okay, you were able to maintain that position, and so you didn't lose your balance. So that was the Romberg test, and now I'm going to assess your range of motion. So go ahead and just copy what I do and keep your hands in a circle. Do one up front, and the other one in front. Behind you, and the other one. And above your head, hyperextend it across. Down and back behind you. Okay. And do your neck in a full circle. And now do your legs in a circle. In a circle. Okay. And do one behind your other leg. And then the other one. And do in front of your other leg. And the other one. Okay, so you do have a full range of motion in on all extremities and in your neck. So we did assess that. And that is all of my assessment. So that's the end. Thank you for your participation in this assessment.